mental health disorders are so common. A lot of our patients do come in crisis at the end of their rope, feeling suicidal or completely overwhelmed with their lives. Being able to help them and provide safety for that patient, that's really the goal of why we do this.
Justino was one of my first patients. He has a very traumatic history, a lot of dysfunction in the family, abuse, sexual abuse, and a lot of exposure to violence.
I'm from Mexico, a small town. Had a lot of violence, abuse, many things happen. One thing I remember, my dad always say, why he give me violence, because he had violence in his family. When your family don't like you, you start to feel bad. Many things he say me about my sexuality. It was so sad when you grow up in a small town and the people don't have open mind. Because I'm gay, for that the people discriminate me. I decided to come to USA and left everything there. And I try to forget it, but those things is not easy to forget it. I was 20 years old, and I don't have nothing with me, just my clothes. No money, no nothing. Many things it was happening in my head. Depressed, drinking a lot alcohol. Crazy my life, you know. I was thinking when I came to USA, okay, everything be better, everything be changed. But no. One day I decided to ask for help because I was so sick. It's really bad.
Justino? When I met Justino, he was very afraid, very shy, very little eye contact, and he had just attempted suicide.
When patients arrive at our clinics, they have gone through various traumatic experiences, especially if they are immigrants from other countries.
I think for many of our patients, they feel stuck, they feel isolated. They don't feel like they have the ability to communicate with others and advocate for their needs.
The first few months, a lot of the work was getting him to just feel comfortable.
Behavioral health at Saban Community Clinic really looks at the wholeness of the person. We offer therapy, psychiatric med management, anger management groups. We also do substance abuse counseling, mindfulness training, a lot of ancillary services to really help the whole person.
We provide care to anybody who's walking through our doors, regardless of their ability to pay.
I've been working really hard to change my life, my mind, my body. Sometimes you think it's the people that need to change, but it's not the people, it's you.
His confidence is night and day. He's comfortable with himself, he's comfortable in his own skin. He's ready to take those bigger steps, and now he's not afraid to say what he thinks or needs. He's just very hopeful.
Once a person becomes assertive, becomes their own advocate, something shifts, something changes. They're onto a different path. And we've seen that with Justino, we've seen that with many of our patients.
Now I'm the person I am for Julissa. She helped me a lot. I feel I can do everything I wanted. Baking and cooking, those things make me happy. I want to start to sell my cakes. My mind changed, and I say, things happen easy if you're positive.
We are making a difference in our patients' lives, one by one, and we do save lives.